A cancer diagnosis can be devastating, and when a pregnant woman got the news, she was forced to make some pretty quick choices. Dr. Joe shows how her doctor saved her life and the life of her unborn child.
Jenny Davis was just 5 weeks pregnant with her third daughter, Brantley, when she felt a lump. She was still breastfeeding her second child, 7-month-old Nolan.
I thought it was milk, and I wasn't worried about it.
Doctors were worried, but because she was so early in her pregnancy, they waited to biopsy the mass.
During that time, just a couple months, the tumor had doubled in size.
She was 27 and diagnosed with one of the most aggressive types of breast cancer that we see, which is triple negative.
I was very scared.
Jenny's oncologist felt they had to start treatment right away. 4 rounds of chemo during her second and third trimester, 2 more after the baby was born. The idea to Jenny was terrifying.
Trying to save my life and trying not to harm her life was very hard.
Even doctors were surprised pregnant women can be safely treated with chemo using a special combination of drugs that is less toxic to the fetus.
As long as you wait till the second or third trimester, after most of the baby's organs are already formed, that the potential birth defect risks are a lot lower.
I went through 3 types of chemo all at one time, and I went every 3 weeks. And since I had 1 lymph node involved, I had to go through 6 rounds of chemo.
During her infusions, Jenny could feel kicking. But then another challenge. Brantley was diagnosed in utero with a cleft lip and palate, birth defects not related to the cancer or the chemo. On Jenny's 28th birthday, Brantley was born, spending her first 2 weeks in a neonatal intensive care unit.
A big weight was just lifted when we knew that we got to bring her home, and we were all together. And that, I've got to do this. I've got to do these last 2 chemos.
Because she tested positive for a gene that raises her risk of both breast and ovarian cancer, Jenny chose to have both breasts, her uterus, and ovaries surgically removed.
When you see someone like Jennifer Davis, who's gone through all the obstacles and she is still shining brightly, it brings a big smile to my face. She's a success story that keeps you getting up in the morning and doing this job.
Brantley is now 5 and doing great. So is Jenny, cancer-free, 5 years, 4 months, and counting.
I am so fortunate to be here, and I get to live out my dream, to watch my kids grow up and to take care of them.
I'm Dr. Wtvt, Fox 13 News.
All right, the Bucs